So types of seizures are there's two types that we'll discuss. It'll be partial seizures and then generalized seizures. So how do the drugs work for seizure disorders? They suppress the sodium influx, they suppress the calcium influx, they promote potassium efflux, and they block the receptors for glutamate, and there's potentiation of the GABA system. So there are two main categories of anti-epileptic drugs. You have your traditional AEDs, which are your Dilantin, Tegretol, Trileptal, valproic acid, phenobarb, and then your newer AEDs, which total 14. So your Dilantin is used for partial and tonic-clonic seizures. Mechanism of action is selective inhibition of the sodium channels. You have varied oral absorption rates. Half-life is 8 to 60 hours. Therapeutic levels are needed for this drug, and it's between 10 and 20 micrograms per milliliter. Therapeutic uses for epilepsy and for cardiac dysrhythmias. Adverse effects, you have nystagmus, sedation, diplopia, ataxia, cognitive impairment, gingival hyperplasia, skin rashes, if you have effects in pregnancy, and cardiovascular effects. Interactions with oral contraceptives, warfarin, glucocorticoids, increases the level of diazepine, of INH, of cimetidine, alcohol, valproic acid. So dosing is highly individualized, and especially with having to get levels, and administration you want to give with food. Next would be Tegretol or carbamazepine. It's used for epilepsy, for bipolar disorder, for trigeminal and glossopharyngeal neuralgias. It suppresses the high-frequency neuronal discharge in and around the seizure foci. Adverse effects can be nystagmus and ataxia. You can have hematologic effects such as anemia, thrombocytopenia, birth defects, hypoosmolality. You can have dermatologic effects such as rash and photosensitivity reactions. Drug-to-drug or drug-to-food interactions include warfarin, oral contraceptives, Dilantin, phenobarb, and grapefruit juice. Next, we'll talk about valproic acid or Depakote. It suppresses high-frequency neuronal firing through the blockade of the sodium channels, suppresses calcium influx, and it augments the inhibitory influence of GABA. It's used for seizure disorders, bipolar disorder, and migraines. Migraines, remember, it's used for prevention. For bipolar, it's used for mood stabilization. There can be GI effects, hepatotoxic effects, pancreatitis, teratogenic. So especially in use for bipolar disorder, we don't use it in childbearing women unless they're going to adhere to having a pregnancy test before they start, be on a birth control method that's reliable, and get regular pregnancy testing. Drug interactions with phenobarb, Dilantin, topiramate, Topamax. Zerontin is a drug of choice for absence seizures. It suppresses neurons in the thalamus. that are responsible for generating these absence seizures, um, generally devoid of significant adverse effects and interactions, and initially can cause drowsiness, dizziness, and lethargy. Phenobarb reduces seizures without causing sedation. It is an anticonvulsant barbiturate, potentiates the effects of GABA. It's used in epilepsy for sedation and induction of sleep. So while it reduces seizures without sedation, it is a sedating medication. Adverse effects: it has neural psychologic effects. There is dependency issues, and phenobarb is abused on the street by patients with addictive problems, with addiction problems, will find that they can take a lot of their phenobarb because they get that sedation that they want, or that altered sense of self. There can be exacerbation of intermittent porphyria, rickets, osteomalacia, nystagmus, and ataxia can be some of the adverse effects. Interactions are with oral contraceptives, warfarin, and CNS depressants because it does add to the sedation. Valproic acid, and there would be drug withdrawal, which makes sense because of its CNS effects. And this is the end of the seizure lecture part 1.